So one of the most common questions that I get about Zach's situation is, what is a bone marrow transplant and why does somebody like Zach need one? Well, people that have leukemias and blood disorders, and I think even some immune system disorders, their blood just doesn't work right. So like somebody who needs a heart transplant, their heart is not working correctly, or somebody that needs a kidney transplant, kidney's not working right. He just has, if you want to call it, bad blood, and he needs new blood. So your blood is made in your bone marrow, and that's really like the manufacturing center of your blood. And so people that need new blood, essentially what happens is they give them massive doses of chemotherapy to kill off all of their blood making capacity, to kill off all their marrow. And once they've done that over a few day process, then all they do is they take the bone marrow from a donor and really they hang it in just an IV bag. And the stem cells from the bone marrow basically float through the blood and get into the crevices in the bones, and they take up residence in the patient, and they start manufacturing more and more blood cells. So essentially, you're giving somebody, by giving your stem cells, your bone marrow, you're giving them a whole new set of blood, which is what they need to fight their disease. The bone marrow donation process is really very straightforward. My 3-year-old son, Jake, was Zach's first bone marrow donor. And the process can be really one of two methods. First, you'll be asked a lot of questions about your health history. You'll get a checkup. And the way I understand it is in 80% of the cases, they'll give you some medicine over a few days that will stimulate your stem cells. And after they finish giving you those medications, then a needle goes in one arm, and another needle goes in the other arm, probably similar to donating platelets, though I've not done that. And basically, they filter out the stem cells that they need, and they put them into your standard IV bag. And I think that process takes about a day, maybe 2 days. For my son Jake, he actually had, and this happens in 20% of the cases from the donor, it's a simple outpatient procedure where they give you some anesthesia and they take the bone marrow from your hip bone and your back. Jake was completely asleep, and he woke up from it and he was running around the next day.
And they do it with an injection. It's a simple, they inject and then they draw it back out. So there's no incisions, there's no surgery, there's nothing intrusive into the bone other than just a small needle.
But I really think it's a really high honor to be called as a bone marrow donor. It really is as significant as giving your heart or your kidney or your liver, but you can walk away the next day. And it's so easy just to register and be tested with a simple cheek swab, and it really is a lifesaver for many. Oh!
Zach!
Zach!
To give me hope and grant me a chance to strive, to be all I am and all I can be. To sing and dance and play for all the world to see. God, I pray for a cure. I have been given so much to endure. Through your grace and strength, you keep me strong. Even when the days and nights can be so long, send the hand of an angel my way. I am willing this day and every day. Send the hand of an angel, send it my way. God, I pray for a cure. God, I pray for a cure.